Should the government, the federal government, be taking more control and determining who gets what testing when? Simply because if you're always going to have more demand than there are resources for it, inevitably what happens in situations like that is that the wealthiest areas, the wealthiest people, get to have these tests whenever they want. I coughed today, so I'm going to go get a test. Maybe that's not the best way of allowing the market to do its work when you're dealing with a pandemic like this.
So we have to be flexible, and this is the reason. Early on, we had a very tight limitation of testing, so we were really dealing with only those who were symptomatic in the hospital or healthcare workers. Now it's very, very important that we actually test those who are asymptomatic. Now, just feeling like you want to go get a test is really not the best strategy. But we know that most of the spread are from asymptomatic people, particularly young adults. So you've got to cast a wide net, and I think we're able to do that. When I talk about unnecessary testing, we know that there's a lot of people who are being asked to retest themselves at the end of their illness. And some people are getting tested 4, 5, 6 times, and that's just really unnecessary. According to the guidelines, if you're 10 days since the onset of your illness and at least 3 days asymptomatic, you're fine. You're not going to shed the virus. You can go back. It's like whoever has the flu, you never go back and get tested 2 or 3 times for the flu. Now, this is not the flu, but I try to draw that analogy. So we need to decrease those tests, but we also need to allow asymptomatic people to be tested.
Look, I get it, though. I mean, you're right. It's not the flu. I don't worry about the 10 days after getting the flu, the thought that if I see my mother, I'm going to kill her. I mean, this is a different scenario. And again, just back to this idea, I don't know who you put in priority and who you don't, because the only way we can really do contact tracing is that if everyone is getting their test results back in a very timely manner. I mean, even 3 days is tricky. There are a lot of people who won't stay home and do what you're told to do, which is to quarantine if you've had a COVID test. I've seen it already with people who are supposed to be quarantining after getting those tests, after getting the test but waiting for the results, and them not doing it.
So let me just address a couple things. There is a natural course of getting over this virus, and we know after 7 or 8 days since the onset, you're not shedding live virus. So if you have that 10-day window, you're not going to hurt your mother or grandmother. It's not necessary to get retested unless you're in a very special group. And in terms of turnaround time, look, I agree with you. We need to decrease the turnaround time to as minimal as possible. That's why half of our testing is within 24 hours of point of care. That's why we're moving point of care testing into nursing homes. That's why we're doing all the things with pooling. But the reality is right now, if you send to a large commercial lab, given where we are, that turnaround time is about 3 days. And we're going to have to be precautionary during that period of time. If you're really at risk, if you were just at a big gathering and a lot of people have the infection, whether that test is positive or not, you need to sit at home and isolate yourself until you make sure you're not going to become ill or become positive. And very importantly, we know how to take care of this. Wear a mask, avoid big gatherings. Going to bars, particularly in those red zones, is not a good idea. And we certainly support closing indoor bars and limiting restaurants. And if you wear a mask and do those things, we don't need to close the economy. We can keep the economy open, but we've got to be absolutely disciplined and diligent about those simple measures and also include hand washing in that. Wearing a mask, avoid those gatherings, and we can fix this. And we're seeing that right now, even in the Sun Belt states. We're seeing the early indicators that the outbreak is starting to become managed by the percent positive cases and the ER visits going down. We have a long way to go, but I think we are turning this corner.